Hello, my name is Matthew Burge. I'm a medical oncologist at the Royal Brisbane Hospital. I specialise in research and treatment of patients with gastrointestinal cancers, including neuroendocrine tumours, and I'm passionate about advancing care and quality of life for patients with these cancers. I saw a huge unmet need to help people, and being able to help people in the way that I can is a huge privilege and gives me joy every day. So all cancers arise from particular cells in the body, and neuroendocrine cancers arise from these neuroendocrine cells, which are present throughout the body and whose function is to produce hormones, endocrine hormones, and to coordinate the activity of the gut and other organs throughout the body. Around 5,500 new patients are diagnosed with neuroendocrine tumours in Australia each year. But because these tumours tend to be slow growing with a better survival time, there are many more patients than that living with neuroendocrine tumours in Australia at any one time. And there are more and more of them as time goes along. Neuroendocrine tumours often produce very non-specific symptoms. They're still not well recognised, often in primary care. And these two things combine to cause often a delay in diagnosis of these tumours for often months or even years. Neuroendocrine cancers are becoming more common. We've seen that over the last 10 to 20 years. It's only going to continue. So the problem in Australia from neuroendocrine cancers will be much bigger in 10, 20 years' time than it is today. So STOPNET study is all about how to best use the most commonly used treatment in neuroendocrine tumours, which is somatostatin analog injections. These are injections given once a month, and they're usually given long term, at least at present. The problem is we don't know how to use them optimally. After successful radiation treatment, we don't know whether they need to be continued or not. At the moment, we continue these injections, subjecting the patients potentially to side effects, monthly painful injections, which impacts significantly on their quality of life, not just for a short period of time, but potentially for years. Therefore, we really need to answer the question as to how best to use these injections to optimize patients' quality of life and best use our healthcare resources to direct it where it's really needed. So when patients are being treated with these monthly injections, over time, we know the tumours will grow despite being on these injections. And at that point in time, we switch them to the specialised targeted radiation treatment called lutate, which we know can shrink the tumours and keep patients alive for longer. What we don't know after this lutate treatment is whether these monthly injections are still required. We, at present, do continue to use them and subject patients to the monthly injections and possible side effects, but we just don't know. So in STOPNET, half the patients will continue the injections and half will cease after the lutate treatment. And we'll compare the two groups over a period of 2 years when we follow them up. We'll pay particular attention to patients' quality of life, symptoms from the neuroendocrine tumours, and psychological impacts of stopping these somatostatin injections in those group of patients that do stop them. What we know with patients with neuroendocrine cancers is that they are often alive for many, many years, and therefore they could be on these monthly injections for many, many years. So we're talking about a long-term impact on their life and impacting on their ability to go on holidays and to enjoy time away from healthcare facilities with their families. And so that's why only giving these injections to patients who really need them over this long period of time is so crucially important. Of course, also, there are significant healthcare costs and resources that are used for these long-term treatments, and we need to use these as effectively and rationally as possible. We're going to know how best to use these monthly injections, which form the backbone of care for patients with neuroendocrine cancers and are used in nearly every patient that has a metastatic neuroendocrine cancer. We will know much better how best to use these drugs. I'm hopeful that the findings from the STOPNET study in Australia, in conjunction with similar research going on in other countries around the world, will most certainly be practice informing and even practice changing for the better for our patients in the future.